So good day, I am Marc Panaligan from BSN 2A Group 7 and I am here po to perform the administering oxygen via nasal cannula. So the purpose of this is that the body is constantly taking in oxygen and releasing carbon dioxide and to release the saturation in tissues where the saturation levels are too low due to illness or injury. So good day, I am Marc Panaligan from BSN 2A Group 7 and I am here po to perform the administering oxygen via nasal cannula. So the purpose of this is that the body is constantly taking in oxygen and releasing carbon dioxide and to release the saturation in tissue where the saturation levels are too low due to illness or injury. And mucous membrane, chest expansion and breathing patterns, lung sound by auscultating the chest po. So, i-check ko po muna yung kanya pong skin. Then, ang kanya pong mucous membrane. Then, ang breathing patterns niya po, yung pag-inhale at pag-exhale po niya. Tsaka po yung lung sound po by auscultating the chest po. So, pag mag-auscultate po tayo, yung bell po ng stethoscope po ang ating gagamitin. Sir, inhale po. And exhale. Then, i-prepare na po natin yung equipment natin gagamitin. The oxygen tank, the oxygen regulator or the flow meter, humidity cup with distilled water and nasal cannula po. And check the physician's order for the need of the oxygen therapy. Then, assist po natin ang ating patient at ipopresto po natin siya sa semi-folder po. Then, we will explain to the client what we are going to do. So, i-semi-folder ko lang po. So, good day po sir. I am going to inform you that using oxygen is safe, especially if you follow this safety precaution which is do not use flammable materials if we are using oxygen. Siyempre po, magpapakilala po muna tayo ng ating sarili. So, good day po sir. I am Marc Panaligan, your student nurse for today. So, after po that is, i-ask po muna natin kung ano po ba ang pangalan po ng ating patient at saka po yung kanya pong birthday para po malaman natin na siya po ang ating right patient. So, as I said earlier, I will be doing administering oxygen via nasal cannula and you need a low concentration and minimal support of oxygen and it will help you breathe easily and relieve some discomfort po. And ang gagawin nyo lamang po is follow my instruction to avoid any problems and discomfortion po sir. That is, huwag po natin kalilimutan na mag-hand hygiene po. So, and after po that, syempre po, huwag po natin kalilimutan na isara po yung pinto, bintana, o kaya po yung kortina po to maintain the privacy po. For that, attach the flow meter on the oxygen tank. So, i-attach na po natin ang ating flow meter. Ito po yung ating flow meter sa ating tank. Then, fill up the humidifier with sterile water po and ipopwesto po natin ito po sa base po ng flow meter. So, as assume po, nanalagyan ko na po itong humidifier ng distilled water or ng sterile water. Then, ikakabit po natin dito. Then, we need to attach the prescribed oxygen device and deliver device into the humidifier po. So, after po that is, i-attach na po natin yung ating nasal cannula po sa ating pong ito po. Then, after that, we can now turn on the oxygen tank at the prescribed rate and check the proper functioning. Then, check po natin po yung nasal cannula po if may nalabas po bang hangin by doing ganito po. Dito po natin, hindi po natin siya ilalapa to prevent contamination po. Then, check din po natin if may nagpo-flow po dito sa tubing ng oxygen. This is to make sure that the connections are all right po, o yung ayos po yung pagdali po ng ating oxygen. So, makikita nyo naman po sa ating humidifier cup po, dito po, if pag nag-activate po ito, I mean, nagbabubbles po yan, madami pong bula, then make sure din po natin yung nagpo-flow po yung ating oxygen sa ating cannula po. Check po natin by doing this po. Then hindi po natin ilalapat po yung tubing to prevent the contamination po. Now I can start to applying the appropriate oxygen delivery device. Then i-place po natin yung cannula po sa ating patient and i-inform po natin. So by putting the nasal cannula, i-hook up po natin yung tube around po dito. So ito po. Then siyempre po paglalagay po natin, ihaharap po natin sa patient po natin yung tubing po. Then pag ilalagay na po natin, ilalagay po natin sa may ear po. Then for that is pag natatanggal pa rin po yung ating nasal cannula, pwede po tayong mag-apply ng tape para po hindi po magpatak po yung ating pong nasal cannula. Then we will assess the nearest for any incrustation or irritation po, and if there is, we can give water soluble lubricant the mucous membrane and check the top of the ear of the patient for any irritation po. So after po that, we can inspect the equipment because we need to check the liter flow po of the water level in humidity cup in 30 minutes po. And whenever providing care, make sure din po natin na yung water is not collecting independent loops of the tubing and document on the findings on the client record po. So for the evaluation po, we need to perform the follow-up based on the findings, deviate from normal or from expected normal for the patient and relate it on the previous finding if available, and we also need to report any significant deviation from normal to primary care provider. So that's all po. Thank you for watching po.